Hope you can hear me okay. Thanks for coming today. We're going to have a discussion with 4 panellists to really give you a bit of an insight into some of those things that are actually being done in councils, some ideas that you might be able to take away and help you with your planning today. So can you please welcome, we will get their names up there, Lucy Veazey, who's the Recreation Development Officer at Corangamite Shire Council, Lainey Burker, Senior Projects Coordinator, Health and Wellbeing at the City of Melbourne, Melissa Tinney is the Health Promotion Officer at the City of Geelong, and Rosie Beaumont is the Preventive Health Project Officer from the City of Whittlesea. Can you please welcome those? That's on. So each of the panel today is going to speak for a couple of minutes. I'll have a question or two. We'll go through the panel unless anyone's got a really burning question that they really have to have right there and then. But otherwise we'll get through some questions at the end. So by all means, jot down your question and we'll get them at the end. If we run out of time, our panellists will all be here for lunch and you'll be able to have a chat with them then. And their contact details are up the top if you still miss out on the opportunity. So first off is Lucy, who's going to give us a bit of an insight into the work she's been doing.
Hello. Oh, good. Sorry. Thanks, Stephen. My name's Lucy Veazey. I'm the Recreation Development Officer from Corangamite Shire Council. So for those that have no idea where Corangamite is, we're about 2.5 hours southwest of Melbourne, based in Camperdown is our office. So if you head down to the 12 Apostles, that's us. So I'm here to talk to a partnership between the Corangamite Shire and the YMCA. Corangamite Shire have 6 outdoor swimming pool facilities that we manage on a seasonal basis. This outdoor pool season, Corangamite Shire and YMCA partnered to implement a water-only policy at our swimming pool facilities. This is the first year we've done such an initiative. We're a little bit creative in the way that we went about this. We made no consultation with our communities to implement this policy. The reason we did that is because it's actually in our contract specifications for the contract manager to actually have healthy food and drink options in our kiosks at our swimming pool facilities. So we just quietly went about our way and decided to stock the kiosk with water. We also offered some lightly flavoured water options just to, kind of offset any negativity that we may encounter from the communities. However, I can report that we received no negative comments whatsoever about putting water into our facilities, and our consumer buying habits didn't change. We still sold the same amount of products, even though it was only water, which is great for us. We actually saved 78 kilos of sugar from entering our communities in Corangamite. So this is over the space of a 12 to 14 week pool season, depending on which pool you're at. And we had no negative comments. So that's our story. It's something small and it's a start. We aim to implement this policy in our stadiums now. We've found implementing it into our stadiums a little bit more challenging given the users of our community stadiums. So it's something that we're working towards and we're really excited to see where we go in our future.
Great, Lucy. First of all, my parents live in Corangamite and they asked me to ask you about the rates.
Not my department.
So tell us about what were the key drivers for the change?
Sure. So we have quite a few key drivers in Corangamite. Corangamite community is extremely rural for those that haven't been there, and we have levels varying in socio-economic status. We, as Corangamite, form part of the Great South Coast region, and part of this region there was a strategic plan developed, and obesity prevention was designed as one of the key pillars of work that we're aiming towards. It's also a big part of our council plans and municipal health and wellbeing plans to increase the health and wellbeing of our community. So those strategic processes were really big drivers of it. The YMCA do a lot of work in this space already, so they were all, really keen to partner and move forward with this initiative as well.
And so what's next?
what's next?
Yeah.
So I touched on, we're looking at our stadiums. We're also really interested in working with our sporting clubs. It's a field that has been somewhat challenging, given that kiosks and these sort of things actually make a really big profit for these clubs. So that's where we hope to get to. We also have a new program called Eat Well, Move Well, Be Well, which has been developed to target obesity and provide obesity prevention programs and initiatives to our community. So we're hoping to build on that program as well.
Well, good luck. Can you thank Lucy for your story? So once again, Lainey's from the City of Melbourne, and she's going to tell us your story.
Hi everybody, thanks for having me. I feel like I've got so much to tell in only 2 to 3 minutes.
I'll keep you the 2 or 3 minutes.
Please do, once I start talking it's trouble. Look, I'm proud to say we're doing quite a bit in this space, although it's been quite, a lot of the different initiatives have been at different levels and at different spaces in time, depending on the setting. We're doing across a number of settings. We started back working in the healthy eating space back in 2008, where we ran a pilot. And whilst I can't talk about everything in detail, if there's something that I touch on, feel free to email me if there's a particular setting or initiative that is of interest to your line of work. What we're doing at the moment, we've got a couple of things running. So we're working in our recreation and leisure space. So we've got 5 recreation and leisure facilities, a number of which are contracted out and managed by the YMCA. So we work with Ari and Steve's team, to implement those. I'm in the health and wellbeing team, so we work in partnership. So obviously that we cross over quite frequently and work collaboratively with our recreation team, which is amazing. We've got a really good understanding that our team works, that recreation, or that food and exercise go hand in hand, so that's kind of an easy partnership for us to make. We align with Healthy Choices, the Healthy Choices guidelines, which we now adhere to. We started back have developed our own, in partnership with Nutrition Australia. We had consultants come on board and develop guidelines, which now we have Healthy Choices. We're in line with those, which are very similar anyway, so that's fantastic. What we now have in our 5 rec facilities, some of which have pools, some of which don't, is a no red food policy. So our Healthy Choices guidelines specify that obviously there's a number of foods. Clearly sugary drinks is a red item, so we don't offer any red items, particularly any red soft drinks. Like Lucy, we just went down the lines of, we're just going to do this and we're not going to consult the public. We often work like that in our team. We just kind of do stuff and then ask questions later, or wait until we get pushback, and if we don't, great. If we do, we would address it that way. So we're lucky enough that in the rec space we have a manager that was prepared to take a risk and hit, if we were to take a bottom line hit from profit, he was just prepared to do that. Proud to say we didn't have any major financial implications either from a profitability perspective, which was great, and I can talk about a little bit about that later on. We also are doing some other work in our premier event spaces. So our events such as Moomba, I work with our events team as well. Moomba, Spring Fashion Week, which is obviously a VIP event, Melbourne Music Week, and there'll be 3 new events that I'll be but working with those particular teams this year, where we are offering not only to the community, but also to our crew and staff that are working at that event to offer healthy choices as well, which clearly goes hand in hand with the no soft drink policy. So we have internally, as part of that, we have Epicure, who are a large catering company, at our town hall. So wherever we have events at our town hall, like Spring Fashion Week, we actually work with Epicure and offer, so last year was the first year we worked with Spring Fashion Week, where we made sure that the main grazing item, as we called it, which was a meal, was either green or amber. It's a little bit tricky where alcohol is served at an event, so that's a whole nother issue. So that is kind of treated separately at this stage. We've also just started, we work with the engineering group, who have started a 3-year contract with food trucks across Melbourne. that is new for us in that our Lord Mayor, John Dole, decided that he wanted to send out a media release, we found out later, as we do, and he wanted every single food truck to offer healthy choices. And so we, as part of the contract management and the expressions of interest and those tender contract, that process, had to work that into the contract. So we are now in that task of going out and working one-on-one with each of our food trucks, of which there are 16, and ensuring that they have 3 healthy options, 2 of which must be food, because we're pretty sure that the one will be water, the one drink will be water. So I'll stop there and you can ask any questions.
I was just about to ask you a question, Lainey. So, so what about sustainability of the changes? What are you doing around that?
Yeah, look, we feel like we've been working in the space, and I particularly, having kind of started this as, you know, it's my kind of baby. I feel like I've been more banging my head against a brick wall for many years, but not so much now. It's really great that I guess society's caught up. So we've worked for a number of years in this space, so we've kind of made those changes around sustainability as we've gone. So we're just kind of tweaking them, and I guess as a bit of a buzzword is now nudges. We just continue to kind of change those. So I guess ensuring sustainability now, particularly if we're talking in a rec and leisure space in particular, and then it's flowing over into our event space as well, and I'm sure with food trucks. A number of things that, probably the key things around sustainability are, first and foremost, there's training of managers. So facility managers are going to be completely trained in how to assess food, what to look for, what are the key. So, you know, we sit in head office and that's great, but we actually need those people and champions on the ground in our rec facilities, and there are those staff members there, but it is, you know, the rec facility space is quite a transient, often a lot of casuals who are uni and so forth. So we maintain that, ensure that they have up-to-date and maintained training of all managers, so that then they can champion it within each of their sites. Then that will lead to an internal committee for support. So there's an internal committee that's being developed so that those managers can then come to the committee with any issues or troubles, or, you know, new food items or drink items that come up that may be challenging or so forth. Along with that, there's a guide that's been developed that, you know, answers questions around process and, you know, any other, you know, a manual for use, I guess, a resources manual. And I should say that a key one, we did it kind of backwards, if you like. We started these initiatives and implementing initiatives, and we waited for people to tell us, hey, you need a policy. We went, oh, there you go. So we have a policy that really just supports the work that we've been doing over a number of years, and that is I should specify, we have a libraries and recreation. Our libraries and rec are in the same branch, so it's a libraries and recreation healthy eating policy, and that is going to be fully rolled out over the coming months, but essentially we're working and implementing in that space and have been for quite a while, but I guess it just gives us leverage to sell that initially and to support the staff on site if there's any issues around why we're doing this, why council, you know, etc., etc. We also have at a higher level developed 4 or so years ago a food policy, which talks about food as a systems approach, and a key, there's 5 themes within that food policy, and one of those is having healthy food choices for all, healthy food and drink choices for all. So that's been a key kind of piece that ensures sustainability, and we're able to have that conversation.
All right. Thank Lainey for And so further down the road, we have Melissa from the City of Geelong, Greater Geelong, sorry. Can you tell us about the work you've undertaken?
Thanks, Stephen. It's great to be here today. Okay, so a bit of an overview of what's happening at City of Greater Geelong. We have been working around healthy choices, promotion of healthy choices, probably for the last 4 years under Healthy Together, and during that time we have been working with 4 of our recreation centres to implement healthy choices. So Lara Pool's been one that's been no red category for 4 seasons now, and it hasn't impacted income hugely, so that's had a big influence on other recreation centres across council as well. So over the last 4 years we've had 3 other rec centres that are owned and run, so all 4 of those are owned and run. We run the food outlets as well. So they've all been at different stages of moving towards the healthy choices. So SSB work has been part of that. We worked on developing a food policy which went through council in 2015. So that talked about increasing access to nutritious foods and promoting the healthy choice strategy as well across council. Council's also been involved in the Achievement Program for 4 years, so managing the Achievement Program across workplaces and schools for Geelong. Now we continue to do that for schools, and Council is registered in the Achievement Program as well, and has just met the Healthy Eating benchmark. And the public health, municipal public health plan also obviously mentions within health and wellbeing, healthy eating. So I would say that a lot of the work that we've done with the recreation centres over the last 4 years, we've been able to do a huge amount of work with the help of students. So just putting in a plug about that, health promotion students, dietitian students have been fantastic. Enabled us to sort of evaluate as we've gone along as well. So we've got some really good data and information about the changes and the impacts. So we're currently working on a strategy around specifically SSBs, sugary drinks, which is basically a scaling up of the work that we've been doing around healthy choices in specific rec centres. So this SSB focus is aimed at reducing sale of SSBs to staff and visitors to all council facilities. So it's a broad scale and broad scope of having an impact across different settings. So we have 9 council-owned recreation centres. 5 of them are, the food outlets are run by council, 4 of them are contracted. We don't have YMCA contracts, unfortunately. Those 9 centres have over 2 million visitors every year, so it's a great opportunity to have a huge impact. So we'll be working with the council recreation facilities as well as our sporting clubs in Geelong. 80% of them use council facilities, so we've got a great opportunity to have some impact there. Vending machines we have in our work sites and our recreation facilities, and events as well. So we are looking across every area where council might have an impact on reducing SSBs. It's going to be a 2-phase approach. So we're in phase 1 at the moment of meeting the healthy choice guidelines, so less than 20% of menu and display. So that's in the fridges, the food outlets, in council venues. We're working with council owned and run first, and it's not written into contracts yet, so that's work that needs to be done down the track. We're hoping that, and we have some good uptake actually, or interest from the contracted food outlets as well. The discussion's been going on for a long time now, I think a number of years, so there's a good awareness about healthy choices in general. I think there's a good awareness of sugar and its impacts on health, so we're seeing that on both sides in the contracted as well. Sports clubs is going to be down the track more. There's things going on around sports clubs and fees, rates and fees of hiring the venues at the moment, so that needs to be sorted through. And then we're looking at the possibility of developing a mechanism where if sport clubs meet our criteria around SSBs, they can reduce their rates for hiring the venues, so leasing the venues, so that'll be really good. And in year 2, the plan is to remove SSBs, so start with reduction and then the second year remove. So that's probably an overview.
Thanks, Melissa. Tell us about the internal mechanisms and partners or collaboration that helped you get to the point where you are?
We have an internal working party which really to make this happen across all the different council venues, council sites, we need to have the right people around the table. So the internal working party includes our Rec and Sport representatives from each of the different departments: Rec and Sport, Health and Local Laws, Marketing and Comms, People and Development or HR, and Events, and it's led by Healthy Communities. So I am a Health Promotion Officer in Healthy Communities Unit, which is a new unit that's been established in Council. So we're leading the internal working group. And that's been a really good way to engage the different departments across council, and it's really a way of consulting with the different departments to share what our intention is, to engage their support, and also to get a good idea of how we can make this work better within their specific areas. So engendering ownership as well by the different departments. So that's working really well. And we're starting to talk to external stakeholders. There's quite a lot of interest, as there probably is across the state in different areas in Geelong, around reducing sugar, so the health impacts of sugar. So there's quite a few organisations that are interested, so we're developing an external stakeholder group of some kind. Might be a regional action group around sugar, so including organisations like G21, the Jamie Oliver Foundation is down there, GMHBA, Bowen Health and Bellarine Community Health, Dental Health, PHNs, and we have a local food group called the Food Alliance as well. So, and engaging with our expert friends such as OPC and YMCA and Deakin Uni, looking at ways of evaluating as we go through. So, yes.
Just as Lucy, out of order, but what about in the smaller your regional council? What about your internal workings?
Yeah, so thanks.
I haven't asked you to
That's okay.
answer this, but
we have probably minimal resources internally that focus on this. So to give you some perspective, I'm the only recreation officer for our council. So we do a lot of work internally, but we also have an external network, the Heart of Coringamite, which consists of all our health services, as well as any other key organisations in the community that are working towards the same health and wellbeing outcomes. So we have our internal members sit on, we have 3 different working groups. We have a nutrition, physical activity and social and emotional wellbeing working group. So really it's about, particularly for a rural community, collaborating with as many people that are trying to achieve the same outcomes. Rather than doubling our work, we're trying to, maximise our resources.
thanks. Can you please thank Melissa for and last but certainly not least, Rosie, tell us about Whittlesea.
Okay, hello. At Whittlesea, we've been doing a lot of similar work to the sort of things you've been hearing, and again, it was driven by Healthy Together team initially. So 2014, they kicked off trialling a healthy event out in the community. They went and got Thomastown Twilight Market, which is a local community, and they ran 6 months of markets as healthy events. And one of the key things in that work was creating a resource kit for the stall holders that explained, gave them some of the data, gave them the classifications and that traffic light notion of drinks, gave them a planogram, so how to set up your drinks fridge if you have it, or how you actually go about, promoting water in your display, reducing the display of sugary drinks, taking them away. And that proved to be really, really helpful to get people on board. After that, we moved into a campaign mode where we ran a campaign across schools, sports clubs, leisure centres, but also food courts in our busiest shopping malls. And we did that during Children's Week because kids are really one of the big hooks in terms of, looking at actually considering what your sugary drink consumption is, and the motivation to reduce that children's health is a key one there. What we asked people to do was promote water, again, the standard things. Remove or reduce the display of high sugary drinks, set your drinks fridges up, and do as much creative water display as possible. In leisure centres, we also asked them to run that for 3 months in their canteens, and 2 leisure centres did that. We surveyed their clients before and after the pilot, and we also got their sales data and crunched that down. And again, we found what we're finding across the board over many years now, that if your red drink sales drop, usually your amber and green drink sales go up, and you don't have a significant drop in overall drink sales. So the notion that there is a major commercial risk if you start altering the way you promote and sell sugary drinks is possibly turning out to be a bit of a myth, and we need to keep collecting data with all our individual efforts to build up that data set and that evidence base to start making those cases that support other work like sugar tax, advocacy. We did some fantastic work with our food retailers. We found that, and this was in food courts, so we're dealing with people who are sort of junk food oriented all the way through to healthy oriented businesses. We found out all sorts of things about them. They really want to get on board with health promotion, but they have a limited capacity to do so, often because they're in difficult, commercial relationships with drink suppliers who supply their fridges, and they don't feel like they've got the power or the autonomy necessarily to do this kind of work long term. So they love to do burst campaigning. That's the sort of thing we've found in that setting. We've found that working with schools, look, they take on so much in terms of lifestyle change initiatives. They're keen to do it, but there's a lot of issues with supply. The way that you set up your canteen, and you could talk about sports clubs and leisure centres in this way as well, depending on whether you run it yourself, you've got an external provider, you're a YMCA, whatever. They all bring different implications in terms of your capacity to autonomously change your canteens and do this kind of work if that's what you'd like to do. And just very quickly, I've been involved in running a project through City of Whittlesea, trying to look for opportunities for collective action across the North Metro region, and mapping all the health promotion work that's been going on there. Sugary drinks popped up as an issue that had momentum, it had focus, and it had people trying to do pretty much the same thing but across a broad range of settings, and that started to look like a textbook collective impact, systems approach to health promotion. The thing that Healthy Together was banging on about for ages, and the thing that's been sitting in theory for a long time, if you actually go and look across your region, so all the work we're doing, for example, or in the North Metro region where I am, you start to see that we are in fact informally moving in a collective impact way on issues like this. So my project's identified sugary drinks as an issue to trial a catchment-wide campaign and hopefully develop a healthy drinks plan with all the member organisations with the North East Primary Care Partnership. So that's going to be fantastic because we're going to be bringing in a range of groups, including organisations who deal with mental health populations. Very different area, we haven't gone in there, but sugary drink consumption's a huge problem for that population, enormous problem. So it's going to be fantastic to broaden the effort and to move into other settings and see how this looks when we formally align ourselves and when we recognise that our work complements, work in other settings, and build, very importantly, that data and look at where we can standardise our language, standardise our measures, standardise our methods, so that we start to get that bigger, broader push, that scaling up of this local level push. So that's kind of very quickly what's been going on in Whittlesea.
Is that all, Rosie? That is a great story, and the extension of your work into the community and bringing other organisations in is really the next step. How did that unfold? Was that just you knocking on doors?
That was me. No, well, I suppose I was involved with Healthy Together as an evaluator. So I had a sort of broad sense of some of the work they'd done and some of the effectiveness of different strategies. And there's difference tolerance in our community for different approaches, which is one of the key things that we've learnt from evaluating our work and continuing it, and then being able to take that sort of very loose evaluation analysis to other agencies and say, well, you're actually doing this in this space, you know, and if we combine this with this and this and this, it starts to look like a really complex, wide-reaching campaign. So I guess it's just through knowledge actually and data and what we're learning along the way about working in this way that's brought people on board, particularly who want to get involved in this area, but sometimes they think they just don't have the capacity. They assume they have to do a big, you know, well-resourced campaign and they don't have, you know, the resources to do it, but in actual fact it's already happening everywhere. And I suppose the only other thing that people have really picked up on is, you know, that tolerance in the community. It varies. So if you ask people if you want soft drinks taken away from them when they go to a community festival, they say no. But if you ask them if they want it taken away for their kids, they say yes, go for your life. So out of Whittlesea, our children's Rockin' at Red Leap Festival is sugar drink free, but our community festival is not, because they would rather say, I'm an adult, give me information, give me labelling, give me more water. Make it easier for me to have access to water. Give me a wider range of affordable, healthy food and drink options. That's what I want you to do for me. But for my kids, go in hard, chuck the Coke out, you know, raise the prices. And captive audiences in places like hospitals too. They'll cope with that in the vending machine. But interesting, in workplaces, there's a lower tolerance. And there's a lot of pushback, big debate at the moment. Let me make the decision. Yeah.
Can you thank Rosie, please? So a lot of people have been taking notes there, but a couple of things that you know, stand out to me is, you know, the big stumbling block that I think many have troubled with is around the financial impact. And we've had 4 examples. I'm not going to beat Ari's drum, but she's going to tell you of a 5th one, but the financial impact is, as you know, Rosie just said, you reduce the red, there's a direct substitution, and that's becoming more and more obvious. And while as health professionals we get that, the operators of the canteens and the rec centre and all that may still continue to have that struggle. So we've got to be able to, you know, show them the evidence. But that's a really clear message coming through, and also the community support or the lack of resistance. I think you just you know, shared at the end there the difference. But in some examples, I'm not sure that some communities even know that those red drinks aren't there anymore. It's a matter of seeing what's there. The need for, you know, policy guidelines to you know, as a base for your communities. And in Victoria, obviously, everyone's, you know, very fortunate to have the Healthy Choices, you know, guidelines there as a base and be able to pick up and use. And clearly, we've heard, you know, recreation centres are the low-hanging fruit, but you know, events and whole of council, you know, activities and policy is the opportunity when the wellbeing plans come in. And of course, building those internal and external partnerships is really important to build sustainability and momentum.